Well, it's my pleasure to participate in this webinar, and thanks to COS for funding this type of activity in which that Paulo explained before. We want to share the word about the importance of open disclosure and some ideas and some innovation that we can use in our daily practice. Well, in this short presentation, I would like to introduce you in the paradox in which patients and professionals agree that there is a need of information, a clear information, honest information after an adverse event, after any safety incidents, but at the same time, not always the right information is provided. Many times there are barriers, there are some worries, there are fear as well, and in some cases, patients are not receiving this type of information. In this case, in some studies, if we are able to review the result of the research on open disclosure, there is the frequency of open disclosure in the case of physician is about 60% and 30% in the case of nurses. This is the figure of professionals that are sharing with us that they have some experience in open disclosure and honest information to the patient after an adverse event. But at the same time, there are only a few professionals that have the experience to apply, to use some guides to introduce patients what happened during the adverse event. Really, studies are suggesting that only near to 40% of the patients who are receiving acceptable disclosure. So these type of figures, I think, are inviting us to think what we are doing, what we can do, and to learn about some good experiences in some countries, because there are international guidelines, there are some suggestions, and in this webinar, my colleagues are introducing you in specific aspects that you must consider when you are taking with this situation. Open disclosure currently is not internally protocolized in our healthcare facilities. So less than 50% of institutions recognize that they have guidelines of some protocols, of some recommendation from their professionals. So we have a challenge, and we need to face with this challenge in order to improve not only the information, also the caring that we are providing to our patients. So thank you so much, Paulo, for this time to introduce these general insights and this paradox in which all of us agree to inform, but only a few are really informing patients after an adverse event. Thank you.